My name is Victoria Corsano, and this video I'm going to be explaining the procedure and the purpose of a Bucks traction device. So the first thing that I will do is check the provider's orders. So I would be doing that before I go into the patient's room. All right, so then I'm gonna knock on the patient's door. I'm gonna come in, introduce myself, and identify the patient with two identifiers. I'm gonna look at their bracelet, ask them their name and date of birth. And then I'm gonna come over here, wash my hands, perform hand hygiene, and I'm gonna put my gloves on. All right, so I'm going to explain the procedure to the patient. So the traction device is used to put tension on the bone. Its purpose is to straighten the broken bone or the joint, and it's going to put it back into place. There are two types of traction. They are the skin traction and the skeletal traction. The purpose of the skin traction is when soft tissues need to be repaired, like a muscle or a tendon. Less force is applied during the skin traction to avoid any damage or irritation to the skin. And the skeletal traction is to guide the body part, or I guess I could say the bone, back into place, and it will stabilize that bone. So two nursing interventions that I can assist a patient with relief from muscle spasms would be a gentle stretch or a massage, and applying hot and cold depending on the pain. And if my patient reports severe pain from the muscle spasms, the cause could be that it's the muscle or the tendon is not stretched enough. Stretching reduces muscle spasms. Okay, and if the interventions are not helping the patient or reducing the patient's comfort, we would contact the physician. Okay, so once the traction device is applied, you want to make sure that the correct balance between the traction pole and the counterforce is good. You always want to make sure that the weight does not touch the floor or rest on the bed. You always want to check the traction device and the equipment frequently to ensure that it's functioning properly. You want to inspect it as well, including the rope where the weight is connected there, to make sure no fraying or loosening is happening. And you always want to check weight consistency with the provider's orders to make sure we have the correct amount of weight hanging. And I would explain to the patient what we would need to be assessing. We would want to monitor skin integrity, breakdown of the heel or any part of the leg there. We would also let the patient know we need to report pain. And the infection signs that we would be looking for is discharge, redness, or inflammation. And every 6 to 8 hours is when the circulation will be monitored. And after moving a patient, we want to check that circulation is going on as well.